This is an important study, as you know perfectly, actually. Trastuzumab deruxtecan is approved for patients with HER2-low disease. I mean, immunohistochemical 1 plus and 2 plus, with each non-amplified. All the data we have are coming from the DESTINY-Breast04 that used trastuzumab deruxtecan in patients after chemotherapy. What is going to do the DESTINY-Breast06 is to evaluate the activity of trastuzumab deruxtecan in patients who never received chemotherapy after progression to 1 or 2 lines of previous endocrine therapy. And it will expand also the use of trastuzumab deruxtecan in those patients that we defined HER2 ultra-low. I mean, any staining between 0 and 1. This was a prospective randomized trial, including patients with immunohistochemical 1 plus and 2 plus and each non-amplified, or HER2 ultra-low disease, any staining between 0 and 1. They received maximum 2 lines of endocrine therapy with biological treatment like CDK4/6 inhibitors, and they have been randomized to trastuzumab deruxtecan versus chemotherapy of investigator choice. In the final analysis, in HER2-low population, trastuzumab deruxtecan improved the median progression-free survival from 8.1 months to 13.2 months. When evaluating also the patient population with HER2 ultra-low disease, I mean any staining between 0 and 1, trastuzumab deruxtecan improved median progression-free survival from 8 months to 13.2 months. So the PFS improvement in HER2-low was consistent with the results in HER2-low population. Overall survival analysis still immature. We have 40% of the events, but with the landmark analysis of 1 year, both HER2-low and HER2 ultra-low have an improvement in overall survival from 78 months to 84 months. I would like also to highlight that all subgroups derived exactly the same benefit, and that response rate was 57% in the intent to treat population versus 61% in their HER2 ultra-low. In the chemotherapy arm, overall response rate was only 30%. This is an important question. The safety profile of trastuzumab deruxtecan was consistent with the data already available. Median treatment duration was 11 months for trastuzumab deruxtecan versus 5.6 months for investigator choice chemotherapy. We have to remember that adverse events of special interest included, unfortunately, interstitial lung disease. We observed 11% of ILD events. Only 3 events were grade 5. The DESTINY-Breast06 demonstrated that trastuzumab deruxtecan as a new treatment option in patients with HER2-low and HER2 ultra-low population after 1 or 2 lines of previous endocrine therapy. So this is, of course, a new standard of care for those patients who progressed 1 or more lines of endocrine therapy and never received chemotherapy.